I guess as a chiropractor, I don't really have a pitch rather than, I guess, an educational talk. And with that, I don't, a lot of times it doesn't take me 6 minutes to give that. So I am Dr. Antonio Rice with Rise Chiropractic. I practice with my wife, Dr. Caitlin Rice, who actually started the practice in September of 2022. As she started the practice, she started more as a pediatric clinic. And after about a year, she asked me to come on with her, and we've turned it more into a not just pediatric, but a family practice. And so what is chiropractic? I mean, as chiropractic as a whole of what we do, and what most traditional chiropractic office will be, you'll see is a lot of your TikTok twisting, cracking, popping, all the sounds and all of those things with none of the education of what is this doing for your nervous system. Us as a neurologically based chiropractic office, we're focusing on one, just removing the interference of anything within your nervous system to allow your body to work to its optimal potential. And what's causing a lot of that interference within your nervous system isn't it's not just as simple as this bone moving and it's stuck and that's where the pain is, but rather life stresses that goes on and then bombards our nervous system, causing us to decline in health. And by those stressors, we call those the 3 T's. Those are going to be your thoughts, traumas, and toxins. By thoughts, we mean emotional stresses, which can be relationships, anxiety, depression, experiences that we hold on to emotionally. And that can be a stress on our life that continually bogs down our nervous system, not allowing us to heal properly. Toxins will be the things that we put in our bodies. So being able to have appropriate produce and things like that, like eating food, not just produce itself, but how is that produce grown? Making sure that we're not intaking a lot of the glyphosates, the other pesticides that are put on our food, and also to our air quality. A lot of these things are that we can't fully control, but they are going to be a stress nonetheless. And then lastly is going to be traumas. And these aren't just your macro traumas of your car accidents, falling off your roof, or getting into fights or anything like that. These can be your micro traumas of sitting at a desk for 8 hours a day and never moving and looking at in poor posture state. Working a manufacturing job to where you are doing the same movement over and over and over, and not training your body to do that movement efficiently. So with those 3 traumas or stressors, we all are in some way, shape, or form exposed to these stresses. So stress is an inevitable thing of life, but the one thing that we can control is our resilience to those stressors. That's where Rise Chiropractic comes in. What we do is in our office, we do 3 neurological scans, which the first is going to be heart rate variability. What this does is it shows, one, your nervous system's adaptability to stress in your environment. So one, we're looking at your part of your nervous system, which is your autonomic nervous system. These are all the things that your body does without you having to think about it. Breathing, digestion, heart rate, secretion of hormones, secretion of enzymes. Your body does so many different functions that you don't have to think about. But if our nervous system is bombarded, or if there is interference within that nervous system, all of these things will not function to 100%. So with that, we're looking to see, one, are you stuck on one of 2 sides of that autonomic nervous system? One is going to be that sympathetic aspect of your nervous system, which is that fight or flight, and that is your protective mode. The other side is going to be your parasympathetic, which is that rest and digest. And then a lot of times being stuck in that rest and digest means there's more of fatigue or exhaustion in your nervous system. Um, with that, we see where you plot on that chart, because that lets us know, one, how is your nervous system functioning, and then also two, we look at your reserve, almost like your battery charge of your nervous system, because you can be depleted. So with that reserve, we look at that as more as what is the resilience that you've built to these stressors. The second scan we do is going to be a thermography scan. With that thermography scan, we're looking at heat temperatures from side to side along your spine, because each and every nerve that comes out along from your spinal cord is going to go to various organs, glands, muscle tissue, and blood vessels. And with that, any sort of interference or stress on those nerves can cause those organs or glands or blood vessels to not function to their optimal potential. And then lastly, we will do a muscle scan. That muscle scan will show us not just the muscle fibers themselves, but the neurological energy of those muscle fibers, those postural muscle fibers holding you up in an upright position. So how much energy is your body wasting just to hold you up straight? Because that can then tax your nervous system as a whole. So us at Arise Chiropractic, we use a very specific tool called an integrator that allows us to not just, we're not fixing you, we're allowing your body to fix itself. The greatest thing what we do is we remove the interference. Your body knows what it needs to do. It only takes no interference for your body to do its job. So we are there to analyze and locate that interference and remove that interference for your nervous system in order for you to function to your optimal potential.